And for more now on the humanitarian crisis, I'm joined by Jason Nickerson from Doctors Without Borders. Jason, thank you very much for joining us today.
Good morning. Thanks for having me.
Let's talk about the situation in Gaza hospitals. We saw aid go through, but no fuel. What is the situation there?
So our colleagues are telling us that hospitals are absolutely overwhelmed. I think very much in a situation where the health system is on the brink of collapse. Our colleagues are working tirelessly. Hospital staff are obviously very, very exhausted. They're doing the best that they can under an impossible set of circumstances. Supplies are running short. We're hearing reports of shortages of things like painkillers, of anesthetics, and so on. So it's absolutely essential that medical supplies and fuel to be able to run generators makes its way into the health system so that essential health services can continue.
You talk about on the verge of collapse. What happens if that happens?
Well, as I say, people are doing the best that they can under an impossible set of circumstances. Colleagues are obviously making treatment decisions with the supplies and the options that are available to them. But we shouldn't allow the health system to reach a point of collapse when there is aid that can come in, so that doctors and nurses have the medicines and supplies that they need to provide essential medical care.
Now, there was 20 trucks that came in with supplies. What percentage of that is actually, how much do you actually need? What percentage is that, the 20 trucks?
So, we're talking about a situation where there were hundreds of trucks coming in every week. This is a population of 2.2 million people. So we're in a situation where obviously medical needs have increased significantly. People have been subjected to heavy bombardments and indiscriminate attacks that have turned a chronic humanitarian crisis into a real catastrophe. So obviously there are acute medical needs, things like traumatic injuries and burns that the health system is responding to. Many of those people are severely injured, so may require things like surgery or admission to an intensive care unit. We're talking about a large volume of supplies that need to come in. But I also want to emphasize that in any emergency situation such as this, people continue to have day-to-day health needs that need to be met. People living with diabetes need access to insulin. People have had cancer treatments interrupted. Pregnant women need safe places to deliver. So it's not just about responding to the acute increase of needs that have been created as a result of this conflict. It's also about ensuring that people are able to access health services, to have their routine health problems managed appropriately.
And there must be concerns as well with the water issues, talking about water supplies running low, things like cholera.
Well, this is always a concern. When people are forced into an impossible situation of not having access to clean drinking water, this is obviously an unhealthy situation. And so the risk of disease outbreaks is always something that is at the front of our minds in any emergency response. We are hearing reports of people drinking seawater and using dirty water, and so on. Honestly, this is one of the things that our staff are telling us as well as one of the real sort of distressing aspects of continuing to work, is that our colleagues are in an impossible circumstance of having to make impossible choices of whether to continue working in hospitals where they are clearly needed and have something to offer, and have a duty to their patients, but also at the same time their families are just like everybody else, trying to access food, trying to access clean water, and so it's a real conflict of where our colleagues need to spend their time.
And before we go, how can Canadians help?
Well, there's a number of humanitarian organizations that are working to get in. Doctors Without Borders, we are a privately funded organization in Gaza. So, donations are obviously appreciated, and there's a number of international and local organizations that are also working.
Jason, thank you very much for your time.
Thanks so much for having me.
Jason Nickerson, Doctors Without Borders humanitarian representative to Canada.